Is it right to expect 100% pain relief from a rotator cuff tear surgery? No, absolutely not. Even the surgeons will tell you that you can't expect the surgery to work 100% of the times. If you're looking to have a surgical repair for your rotator cuff tear, then you must understand something before going into it. Unless you had your rotator cuff tear from a traumatic accident, like a car accident or a really bad fall, and it's obvious that that's what caused your rotator cuff tear, then chances are your rotator cuff tear happened from small repetitive injuries over time, usually over the course of months, possibly even years. It may be related to the way that you're exercising, or it might even be related to the fact that maybe you don't exercise and you're more on the sedentary side, and so you're losing tendon thickness, and then there may be something that you go do that just pushes you over the edge because your tendons weren't prepared for that. In the medical field, these types of tears are called degenerative rotator cuff tears. And it's these kinds of tears that there's a root cause that surgery doesn't fix. Now, surgery for a rotator cuff tendon tear will absolutely reconnect torn tendons. That's what the surgeons are looking to do whenever they're doing a rotator cuff tendon repair. They're reconnecting tendons that have been completely torn. And at the superficial level, this makes sense. If you have a torn rotator cuff tendon, then it would make sense to surgically repair it and put it back together. Now, that can be helpful, that can be beneficial in the short term, but we still have to ask the question, if there was no traumatic injury, how did this rotator cuff tendon tear to begin with? Well, there's something called muscle imbalances. Now, in your shoulder, you have tons of muscles that help control your shoulder blade movement as well as the ball and socket joint movement. And some of these muscles that come up into the shoulder can even affect the elbow. So you have to consider 3 different joints, really it's more than 3 joints, and all the muscles that can move those joints in order to solve the root cause, the muscle imbalance that sets up a rotator cuff tendon tear. Now, in the simplest way that I can say it, there's a weakness in a muscle that's causing the rotator cuff tendons, which are connected to rotator cuff muscles. It's causing those muscles to work too hard, and it's putting too much tension or too much force through the tendon, and over time it can't take it and it begins to tear, and eventually you can have a full rupture or you might have a partial tear. Now, if you can correct the muscle imbalance, if you can get that weak muscle stronger so that it can take some of the load off of the rotator cuff muscles and its tendons, then you can take the tension off the tendon and put normal forces through it, the forces that it's designed to take, so that it doesn't tear. And if it is torn already, maybe a partial tear or even a full tear, so that you might have a chance to heal it naturally without having to get a rotator cuff repair surgery. And consider this, even if you do end up having a rotator cuff repair surgery, the problem, the root problem, is likely still there. In fact, it's probably going to get worse because they have to cut through body parts, they have to cut through muscles and affect the joint, the tendon, and this ends up leaving the weakest muscles even weaker. It's not just the surgery itself, but you have to be immobilized. You have to be in a certain brace and you can't move for weeks after the surgery in order for that tendon to heal, for the surgery repair that what the surgeon did to keep, for it to stay in position. If you go start moving it around right after surgery, you're going to be in trouble. You're going to re-tear the tendon and make the surgery ineffective. So that means that for about 1 to 2 months after your surgery, you can't do anything, and those weakest muscles, the ones that are part of the muscle imbalance, are just getting weaker and weaker as those weeks go by. Now, typically after a rotator cuff repair surgery, after those 4, 6 weeks, sometimes 8 weeks of not moving around to let the tendon heal, people will go through physical therapy treatments, they'll do exercises, but the focus of that treatment afterwards, the rehabilitation from the surgery, is to gain motion back and get back to doing normal activities. But they're not focused on fixing the root muscle imbalance. In fact, they'll probably never mention that to you. They're going to mention terms like you're gaining more range of motion and you're being able to reach up overhead and now you're able to lift up something with a little bit of weight. They'll talk in those terms instead of use this muscle and not that muscle, or make sure that you're moving this specific way so that you're not overloading your rotator cuff tendon. And because this is never discussed after a rotator cuff surgery and during the rehabilitation afterwards, then this leads to those same rotator cuff tendons that have been repaired to tear again in some cases. It's very common for people after having had a rotator cuff repair surgery to continue to have shoulder pain to some degree. Usually it's less than they had before, but very often they're avoiding things that they used to do before. They're saying to themselves, maybe the doctor or the physical therapist told them, well, we repaired the tendons, but you shouldn't be lifting anything overhead anymore. And this is not a good thing, because then you're not going to ever strengthen those weak muscles that set up the muscle imbalance. And they're telling you this because they're trying to protect the surgery that they did. They don't, the doctors and the physical therapists don't want their work to be undone. But in reality, if everything's healed, you should be able to lift things up overhead. It's just that you need to do it properly, correcting the muscle imbalance so that you're not overloading the rotator cuff tendons. Surgery just does not fix that root muscle imbalance. And so there's no way around this. If you have a rotator cuff tear or a suspected rotator cuff tear, or you've had a rotator cuff repair surgery already, and you have never looked at addressing the root muscle imbalance, you need to do it. Otherwise, you're destined to continue to have shoulder pain. It might come and go. It might stay longer than you want. It might lead to another severe problem. But if you can fix that muscle imbalance, which is very fixable, people do it all the time. They do it here in my clinic, and they do it online. In fact, I put my whole treatment approach into a program called the Rotator Cuff Tear Recovery Program, and it walks you step by step through the process to fix the root muscle imbalance, the root cause of rotator cuff tears. So my goal in doing this video is just to set the right expectations for you. I'm not saying don't get a rotator cuff surgery. I don't know your specific situation. It may be that it's the right thing for you to do, but I need to tell you from my experience, I've seen many patients get off the surgeon's schedule because we take them through our treatment approach and they never needed surgery to begin with. And I've also seen many patients that have had the repair already. They're still having shoulder pain, possibly another rotator cuff tear. They go through our treatment approach and their shoulder feels fantastic, lifting weights up overhead again. So just set the right expectations about surgery. Go into it understanding it's not fixing the root problem, it's just repairing the tendons, and maybe you need that, but you need to make sure that you address the root muscle imbalance. Hey, I hope this video helped you out. If it did, please give it a thumbs up. Please share this with somebody you think needs to hear this. I know there's tons of people out there getting rotator cuff surgeries that need to go through our treatment approach, and they can avoid the surgery altogether and feel fantastic, get back to doing all the things they love to do without their shoulder stopping them from doing it. Don't forget to subscribe to our channel and hit the notification bell, and please drop a comment on here. Let us know what your biggest takeaway was. We love to get back to our comments. Thank you so much, and I'll see you in the next video. Bye-bye.